where those variants of concerns have been introduced, we can see a rapid climb in the transmission of the virus, as well as in hospitalization and ICU rates. So we know that from those other jurisdictions that a greater proportion of people being admitted to hospital require ICU admissions. We see younger people requiring ICU admissions. We see longer hospital and ICU stays in those jurisdictions. Right here, our case investigations, the contact tracing investigations are showing that people are holding larger gatherings in their private residences. We're seeing house parties, we're seeing play dates, we're seeing sleepovers. We're seeing cases with many more contacts than we've saw in the recent past. And we're seeing this contribute to the transmission of the virus. And we know that this has happened in the past. You know, as we try to loosen the restrictions, try to you know, allow essential activities, try to have people get back to some of the things that they love and enjoy. The people often have taken that as a return to normal. So you know, individuals are able to go to a dance class to try to get that benefit. And we know that the people have worked very hard in those scenarios to try to reduce the risk of transmission, but then that's taken that they can then have a gathering with people in their home and having a sleepover or a large party. And we just know that that's where transmission takes place, and we see our numbers climbing now. So we continue to see transmission in, you know, in all of our concerning places. This is that prolonged indoor contact, and we just know that. So we see clusters occurring in faith-based gatherings. And again, not a reflection of anything but this virus. This virus is highly communicable. If you're indoors for a prolonged period of time, you're at risk of transmission. And you know, we know that we even see transmission occur outdoors, although it's less risky. But for sure, prolonged indoor contact is where we're seeing most of that risk, and that includes private residences. So we have those orders in place, so we could get back to some of the things we need and want, but it just can't be seen as a return to normal. Or else we'll be right back into the position where we need to start implementing further restrictions, and we may not be far from that right now, given what we see in other jurisdictions. We've been here before. We've seen the early stages of a wave. We've tried to message how important it is for people to follow those fundamentals to reduce the amount of contacts. But what we've seen in our contact tracing is just increasing number of contacts of cases, increasing issues with gatherings, especially in private residences, increasing issue of returned travelers who haven't isolated as per the order, now resulting in many other households as contacts. So we know what to do. We know it's challenging. It's been here for a long time. But if we don't act now, we will be right back into stricter restrictions very soon. So we've continued to look at a number of things with our restrictions, and again, moving forward, this could include moving back to tighter restrictions on private gatherings. We could be looking at that outdoor mask mandate, and really looking at anywhere where people gather indoors for prolonged periods of time. We cannot be in a third wave and put that strain on our healthcare system again. We've mentioned again about staying home when you're ill. We continually hear of cases that have multiple unnecessary contacts because they're out and about while symptomatic. We have people who have delayed getting testing for quite some time because of mild symptoms. So again, our testing capacity is more than the demand that we're seeing right now. So I want to voice to all Manitobans, even mild symptoms, even if you're not sure, get tested. Isolate pending results. This is one of the best ways that we could, avert a third wave, which is pending. It's one of the biggest fundamentals, is staying home when you're sick. So we know that we have, the capacity for much more timely contact tracing than we saw in the abrupt rise in the second wave. But again, for that to work, we need people to get tested early on and also to limit the amount of contacts that you have. So again, if you're ill in any way, just mild symptoms, even if you're not sure, do get tested. We're getting test results back most times within 24 hours. So get tested, isolate pending results, have your household isolate pending results, and we're getting those back quite quickly right now. It's one of the best ways to limit our contacts and the ability to transmit this virus with others. So symptoms, like I said, that many of our cases have had delayed diagnosis and multiple contacts because they've had either very mild symptoms or symptoms that aren't what people expect as typical of COVID. So we're seeing a lot of people with simply loss of taste or smell. We're seeing people with GI symptoms such as diarrhea and no other symptoms. And so they are testing positive for COVID and having contacts. So I encourage you to get tested regardless of how mild your symptoms are. So we know the list of those symptoms, but things like fever, chills, cough, sore throat, hoarse voice, shortness of breath. We mentioned the loss of taste or smell, vomiting or diarrhea for more than 24 hours, muscle aches, runny nose, fatigue, pink eye, headache, a skin rash of unknown cause, nausea, loss of appetite in an infant that is feeding poorly. So just have a high degree of suspicion for COVID right now. Isolate if you have even mild symptoms. Get tested as soon as possible. We need to stop this transmission in its tracks, or we're going to be back to further restrictions. Vaccine rollout continues. Manitobans aged 60 and over are now eligible to get a vaccine at a super site or a pop-up clinic. Manitobans aged 55 to 64 with specific high-risk condition can continue to be eligible for the AstraZeneca or Covishield vaccine. And that applies also to Manitobans aged 65 and older are eligible to receive that AstraZeneca Covishield vaccine at a participating medical clinic or pharmacy. So I encourage you to make your appointment as soon as possible. You can call 1-844-626-8222 or visit protectmb.ca. And so thanks again, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global News, Brittany.
Good afternoon, Dr. Roussin. It's Brittany from Global News. You talk about how restrictions could be coming in if we don't see people starting to tighten up and follow the rules that are in place right now. What is the plan, and why not put some of these restrictions back in place right away and get ahead of what we're seeing in Alberta, BC, and Ontario so that we can slow that from happening here?
Yeah, and so we're looking at things right now. And so there will be more to come this week on our approach to this, but certainly it's important to get that messaging out right now that this is a third wave for us. We've seen that in other jurisdictions. We have restrictions in place right now that can truly work. And in most of the clusters we see, most of the outbreaks we see, most of the cases and cases that have a lot of contacts we see just haven't followed the restrictions that are in place. And so, we need to get that messaging out that now, is that time we need to clamp down on the fundamentals. Really, we need to just stay home as much as possible. It's the best way to end the transmission chains. Practice the fundamentals, and there'll be more to come shortly regarding further restrictions.
we're starting to see more cases, specifically variants of concern that are popping up in schools right now. We've seen places like Toronto who have gone to remote learning. Is this something that we're looking at doing here, and are we seeing any transmission of these variants happening in schools? And can you tell us why or why not that's happening?
Well, we're always looking at measures that will be necessary to protect the health of Manitobans. We know that schools have done a great job up to now to limit the transmission. We do see variants of concern and some transmission occurring in schools, but for the most part, this has been largely limited with it. So we're certainly not taking anything off the table. But right now, we don't have any immediate plans of changing our direction with trying to keep the kids in school. We think that that's a lot of benefit to that. But we do know that some of the most quickly growing cohorts of cases is that 10 to 19 age group. And most of this is not gatherings within school, it's gatherings outside of school. So we really have to stay focused on the fundamentals because we're starting to see that transmission through those younger groups.
From the Brandon Sun, Colin.
Good morning, good afternoon, Dr. Roussin. We're seeing a couple outbreaks in the Boisevane area at the school and at the local hospital and care home. What can you tell us about those outbreaks and how you think the virus is spreading down in Boisevane?
Well, I think that this is just an example of what we've said all the time, is that the transmission of this virus cannot be contained in one sort of area or one sector. If you have transmission of the virus, ongoing transmission of the virus in one area, it's going to eventually be everywhere. So we saw that in the early second wave, where we saw the vast majority of the transmission occurring in those younger cohorts at 20 to 29. But we just know it's not going to stay there for long. It's going to get into other cohorts. And so, these outbreaks, they're all the same. They're going to start in a certain area. If we are unable to keep with the fundamentals, we're going to see it transmitting in other areas. And so I don't have the detailed numbers or all the specifics on on the nature of the transmission, but this is what we'll see anywhere that transmission is occurring. We're going to eventually see that spread to everywhere.
Currently, we're trying to keep a handle on things and track the spread of cases and variants. How helpful has the federal COVID alert app been in your contact tracing process?
So, I think that this is a good tool to have. So I certainly advise and recommend all Manitobans download this app and utilize this app. It's a real tough question to answer because of the nature of the app. This is it's confidential. So anyone who has the app who becomes a case is given a confidential key to punch in, and then any contacts are notified confidentially. So it's not like public health gets a list of all the contacts that were notified or what those contacts do once they're notified. So it's hard to know what the actual impact is here. But I certainly strongly suggest that all Manitobans download this and utilize it. It's just one more tool in our battle against COVID.
From CJOB, Skylar.
Hi, Dr. Roussin. Thanks for the time this afternoon. We have seen, some larger gatherings of folks outside, particularly before today's snow on the weekend. Lots of people not wearing masks, not adhering to social distancing. Places like the Forks or any city parks were guilty of this on the weekend. I'm just wondering what your call is to those people to make sure that they know, just because you're outside doesn't mean you're exactly safe.
Right. No gathering is without risk right now. and so we know transmission can occur in any setting, and the more people who gather, the longer they gather, and the more of them that gather, the more likely transmission is going to occur. And that applies outdoor, but certainly is much more risky indoor. But it's just I think anyone can understand that we've been at this for over a year. It's challenging. We had a very nice weekend, and people want to get out, and people want to get back to normal, and we will. We will get back to normal. But right now, we're facing a third wave, and so we really have to double down to stop this transmission right now, so we don't have to revert to some of the tightest restrictions that we've had in the past. But the way the numbers are looking, the way the variants are being transmitted in other jurisdictions, we really are moving towards that very need.
Yeah, as we're going in the wrong direction and you talk about doubling down, how hard is it going to be to get Manitobans to buy in if we are faced with a third round of restrictions? And is that something you consider when drafting up those?
I think we've always considered it, and that's a major part of why we've had the Engage MB surveys when we're either implementing or lifting restrictions, because we know we need that buy-in. And for the large part, we've seen buy-in. We know that this is a big challenge for Manitobans, for Canadians, for people around the world. So we want to ensure we have that buy-in. We want to keep the optimism there. We do have a safe and effective vaccine. We're rolling it out. We're just not there yet with the amount of doses we can put into Manitobans' arms. And at the same time, we have this third wave coming down on us. So we really need to be really astute to the fundamentals, to the restrictions. And if we really just start staying home as much as possible, we can start breaking that transmission chain again.
From the Winnipeg Sun, Glenn.
Good morning, Dr. Roussin. Glenn Dawkins from the Winnipeg Sun. Considering the impacts of a third wave on the younger population, are you looking at any kind of a more targeted approach to the health orders, such as potentially closing schools? And is there any thought of creating some kind of a standby list? I think similar to what they have in Saskatchewan, where people can get the vaccine if there's any left over at the end of the day instead of letting it expire.
As far as the restrictions go, same as always, we don't have anything off the table. We're looking at our epi. We're looking at how the virus is being transmitted in various areas, and so we'll act accordingly based on that. We do see a lot of transmission and growing amounts of transmission in those younger cohorts. 10 to 19 cohort right now is rapidly growing. And then we know that if transmission occurs in any cohort, it doesn't stay in that cohort. Those who are 10 to 19 have other people in their house. They have other people that they may work with. So we just know that when you see transmission anywhere, it's eventually going to get other places. So we have to do what we can to limit that transmission everywhere. As far as the standby list, I'm going to defer that kind of question to the vaccine task force.
Try this again. I know there have been cases in British Columbia, at least, of the so-called Brazilian variant. Any concerns about it here? I know there are still some uncategorized variants of concern. Is it possible any of those might be within that, or is it, are you concerned about the Brazilian variant making an appearance in Manitoba?
Well, we're certainly concerned about it. I think that we're seeing transmission in other provinces, and where we're seeing that, especially in other nations that have had significant transmission, they're seeing having very difficult times with it. So we're certainly concerned. One of the reasons why we have maintained our isolation requirements on people traveling from outside of Manitoba. So we haven't seen, significant transmission, of that virus here. We do have the ability to characterize it. So as of right now, I haven't seen any significant transmission of it here, but we're definitely very concerned about it.
From CBC Radio Canada, Alexia.
Hi, Dr. Roussin. What restriction could be implemented first if the situation continues to deteriorate?
Yeah, so it's hard to speculate at this point. We're in discussions on just what those will look like. We mentioned some of the things that we're considering. Masks, just having mask use more widespread. And that would include outdoor gatherings. We were looking at because we see a lot of transmission occurring at private residences. And so we may consider things in that area. And then, of course, we see transmission in the usual areas, prolonged indoor contact. And so, again, that's, again, something we're looking at.
And is there a threshold in the positivity rate or in the number of hospitalizations from which you'll make the decision to add restrictions again?
I think we're looking at trends. We don't have anything that's sort of set in stone that once we hit this level, we must have some restrictions in. What we do know is that if we wait for significant demands on the healthcare system, then that's an indicator that's lagging behind. So we're really late in the game if we're waiting to see real significant demands there. So we're watching the trends go up. We're watching how many contacts per case. Of course, we're watching the demands on the healthcare system, but we're facing a third wave. We're at the beginnings of a third wave here in Manitoba, so we need to be alert right now.
From CBC Manitoba, Bart.
Yeah, hi, Dr. Roussin. Along that note, variants are now 11%. Variant cases are 11% of our active cases. We are seeing some growth. It's not as fast as the growth in cases that we saw in the fall, but we're seeing that growth curve on a 7-day rolling average go up. Now, you said a month ago that we will probably have to look at locking things down a lot faster than we did in the fall. Is there any scenario that avoids some restrictions coming in later this week?
Well, I can't predict that. I mean, I think that we're going to watch these case numbers. If these case numbers continue to trend as they are, then we're going to, need to consider acting sooner rather than later on it. So I'm not going to necessarily speculate on the exact timing of it, but we can all see that test positivity climbing. We saw what that meant in other jurisdictions once they saw the rise. So, so we need to, Manitobans need to take this seriously right now, regardless of what any changes in the restrictions may or may not happen. And that's really what we want to get that message out, is that, right now we need to be on top of this because we are facing this third wave.
Fair enough. No deaths today due to COVID, which is great. We have seen some care home deaths in the last couple of weeks. Can you break down how many of those people were infected prior to the immunization and personal care homes starting? How many may have been infected before they acquired immunity, and how many are the result of people coming in? And the reason I'm asking that is there is this belief that the immunization program at the care homes was a shield for the people there, and we still are seeing handfuls of care home deaths. So are you able to break down those care home deaths that way?
Well, I think we can. I don't have those in front of me, but like I say, is that our approach to this pandemic is the public health approach, which is always multi-layered. So we've had messaging, we've had restrictions in place, we've had testing and contact tracing and isolation, and now we have vaccine. So none of these approaches are in of themselves the approach. So the ability to vaccinate our most vulnerable Manitobans in the personal care homes was really great to see, and we can see that obvious benefit. But just like everything, it's not going to be a 100% benefit. So we still have to be on top of all those other layers of protection. So we'll see if we can get those numbers broken down for you, though.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. Given the rise in variant cases and the spread that you're seeing, and you mentioned, the sleepovers and house parties and things like that you're seeing, are you recommending any changes to the vaccination program, either in terms of the rollout or who should be eligible and prioritized?
So this, again, just like all of our approach, we're constantly reviewing these type of decisions. So we do see some of the hotspots in Winnipeg where we're seeing a lot of transmission. We're seeing in other jurisdictions that have shifted their vaccine strategy to targeting some of these higher transmission settings. So we are reviewing that right now. I don't have any final plans in front of me on that, but we do certainly look at what's the best way to roll out our vaccine program.
Okay, and looking forward to when many more people are vaccinated, are you looking at lifting some of the restrictions for close contacts, et cetera, for cases or for travelers? If someone has been vaccinated and they're a close contact of a case or a close contact of someone who's traveled and has to self-isolate, they have to self-isolate as well. Going forward, when more people are vaccinated, will that be lifted for people who've received the vaccine?
So we are looking at that. We want to ensure that people understand that vaccination is very beneficial, not only to yourself, but to the people around you. I want to encourage all Manitobans to be vaccinated as soon as you become eligible, because we really are going to rely on large vaccine uptake to try to get back to normal or to some sense of normal earlier. And so we do have certain things in our public health follow-up right now that right now it's fully vaccinated people. So with 2 doses, they may not be required to isolate. We don't have that in place right now for return travelers, but it's something that can be reviewed over time. But right now our focus is we need as many Manitobans as possible to get vaccinated as soon as possible. And the higher proportion of Manitobans that get vaccinated, the much more likely we can loosen restrictions.
From CTV Winnipeg, Jeff.
Hi, Dr. Roussin. Sorry, could I just get a clarification on what you said earlier? You said there's something going to be coming later this week with regard to restrictions. So are you going to bring forward the latest, say, as you've done before, the latest draft plan on what the next public health order will look like? And are we looking at, and you mentioned some examples, but are we looking at things also as going back to household only and maybe closing down non-essential businesses?
Yeah, so we don't have any details to share on that. I do think that later this week we're going to have further messaging on potential restrictions moving forward. So I don't have any details on that right now, but I do expect that at some point this week we're going to be able to communicate more details.
And on schools, you kind of, for now anyways, seem to say that there's no plans to go to remote learning. But are there other precautions that schools do right now that you might change with the variants of concern?
Well, I think we have a lot of great practices already in those institutions, and they've done a great job right now to limit transmission. Certainly, transmission occurs just like it's occurring in other places. So, I don't think we have any specific plans of changing anything within the healthcare setting or the education setting. But again, it's something that we're going to continue to watch. We do see that increasing cases within that age 10 to 19 cohort. So we're going to be watching that very closely. But a lot of the safeguards that are that have been in the schools have been effective. And right now, that transmission in the younger groups we're seeing really outside of the school setting and a lot of those gatherings that we mentioned earlier.
From CityNews, Jonas.
Good afternoon, Dr. Roussin. I think a lot of folks out here are probably, watching everything happening in Ontario, Alberta, and, probably a little scared that, we could be in for it here. Probably looking for some kind of maybe signal that, there may be more enhanced efforts this time around. I guess just maybe a message to folks that are looking for something this week.
Yeah, I think that the third wave is here. I think we're early on, but it's hard to predict what the trajectory will look like. But in the first wave and in the second wave, we've never been helpless. None of these waves have we been helpless. We all know what needs to be done, and when we put it into orders and enforce it, then we see that decline in transmission. Right, so you can look at it and chart it on any of our waves that we see that climb, we see strict restrictions in place, and then we see the cases come down. So we know what to do, we know how to bring cases down, we know how to prevent large trajectories. Over these last couple of weeks, we've seen that we've again lost sight of that. We've seen a lot of preventable transmission. A lot of transmission that occurred in gatherings that aren't consistent with the public health orders. And so I think that the third wave's here. It's how hard it hits us is really up to us. And so I think we have a lot of control right now to change this trajectory. But it's very likely that we're going to need to change the public health orders again to ensure that we have all Manitobans on board.
Thank you for that, sir. It's something that you said often, the least restrictive means necessary. How does that, I guess, shape how public health responds to things? Is that more like a mandate on your behalf to do not as little as possible, but as least disruptive as possible? And does that kind of shape the response a little bit?
So yeah, it's a very important aspect of public health decision making, of public health ethics, and it's actually in the Public Health Act. That's a requirement. So we're required to consider that with any of these restrictions. So we've known right from the beginning, right from before our first case, that these restrictions have large impacts, large and varied impacts, including on health. But we're always looking at that balance. We've seen in that second wave how close our healthcare system was to being overwhelmed. We saw the people who had to forego non-COVID care because of that our hospitals were overwhelmed with COVID. And so we really can't be back in that place. And so the least restrictive means, of course, it's huge in our aspect of our decision making. With it, and I think we've always achieved that. We've always tried to loosen the restrictions as soon as the epi allows us to. But we're facing again a third wave, and if you look around us, the third wave looks quite severe in other jurisdictions. So we need to be ready for it.
From CHVN, Taylor.
Hi, good afternoon. Along the same lines about what you just said about the least restrictions possible, we see that in some areas like Winnipeg have really high numbers, but other areas have had nothing for months. When these new restrictions do come, how is this being considered?
You certainly always look at is there a regional approach that we can take, and so we'll look at that for sure at every iteration of the orders. We just know that there's a lot of mobility. That transmission, occurs, quite quickly, and the curve rises quite quickly, especially with these variants of concern. And so our focus is to try to limit the transmission overall, and sometimes that's best suited with just province-wide restrictions, but we'll definitely look at that regional approach, and we do so with every iteration.
Thanks. And you're cautioning Manitobans about clamping down, following those fundamentals. But how much of a difference is this going to make when the new potential new restrictions come in the next few days?
Well, I mean, I think it's having Manitobans bought in, and the vast majority of all Manitobans have always been bought in on that. It's always the most important thing, right? We need people to follow those fundamentals. We need people to limit the amount of contacts they have outside their household. And then we have the public health orders as just another tool, to communicate the importance of that, to have the ability to enforce if necessary. But it's always been the buy-in of Manitobans that's been most important.
Our final reporter this afternoon from the Winnipeg Free Press, Katie.
Good afternoon, Dr. Roussin. Can you tell us more about the impact the province is seeing now from returning travelers who haven't followed self-isolation protocols? What proportion of cases can be traced back to people returning from travel now?
So I don't have the specific number. I know that over the weekend we had a couple cases that had returned from travel. Last week I was aware of a case that returned from travel out west that didn't isolate, and 5 separate households were now implicated in this. So there are examples of this, and again, these are preventable. We have those those restrictions, those requirements in place for a reason. This very reason. We advise people not to travel for non-essential reasons. But if you did, we need you to protect other Manitobans by isolating when you return. And if we don't have that buy-in, then this is what we see.
Okay, and you've encouraged Manitobans to get tested for COVID, and previously that's included people being urged to get tested before traveling to northern Manitoba. Do you see a need now for a change in strategy for the third wave in the north, or any tightened restrictions that are specifically aimed at trying to prevent the spread of variants in the north?
So I think that a lot of the things that are in place and the messaging is the non-essential travel. If you don't have to travel right now, whether it's in the province or outside the province, don't travel. We're in a third wave now. Most of the countries have been in a third wave. So there's no reason to travel for non-essential reasons right now. If you do travel, follow the fundamentals at all time. Isolate as per the recommendations and the requirements. And then for the north, we know that we've seen outbreaks in these communities. And a lot of susceptibility to outbreaks due to living conditions that are in these communities. There's more difficult access to healthcare. So if you must travel these communities, we're recommending getting tested before you go. And as far as this third wave goes, we do want people to be tested as soon as possible, to be isolating, have the whole household isolate pending results. It's paramount in stopping the transmission.
Thanks, everyone. This concludes our media briefing.